Okay, as I said, the last of our series, and this is Dr. Kate Berg, and the title is My Pandemic Stories and Perspectives from an ICU Doctor-Mom. Just brief biography here. She's a pulmonary and critical care physician and researcher at the BI Deaconess Medical Center. But also, I've discovered, it seems like a very full-time job, but she also has a post-critical illness recovery clinic. And she does research in the areas of cardiac arrest and various aspects of shock and critical illness. Besides that, as the title suggests, she is a mom and a stepmom. She and the family have been in, well, most of the family anyway, have been in Lexington since 2019. That was right before the COVID started. But during that time, she was on the committee of the First Parish Lex Committee on COVID preparedness and the response team, and that was a big job. She is a local, but she was born in the Boston area, and I don't know if she's been here her whole life, but she has lived in Somerville and moved to Lexington, as I said, in 2019. But she's been connected because of stepchildren in the Lexington public schools for a long time in Lexington. And so it's great. And once she got here, pretty soon, she joined the choir, and that's a great asset for the choir. So we welcome you, Kate, and are so glad you took time from your incredibly busy schedule to join us.
Thanks, Meg. Thank you for the nice introduction. And hello, everybody. So I'm going to try, I watched Liz and Ewan's talk last week as inspiration. I'm sharing the wrong thing. I had to send my husband the link because he couldn't find it either. So let's see. So yeah, so I'm just going to try and share a little bit of my my memories and my perspective of my experience going through the pandemic and my family's, and sort of as a partly my personal experience and partly just as an example of, I think, what a lot of healthcare workers and particularly ICU folks experienced. And I'm going to start with a little bit of a disclaimer is not the right word, but it's sort of just want to point out that although I do work in the ICU, and I did work in the ICU more during COVID than I often do, it's also true that as Meg said, I spent a lot of my time on research, which protected me to some degree. So my clinical time sort of doubled, but my colleagues who, like our medical ICU director, who's pretty much always, 100% clinical and administrative, really basically didn't leave the hospital, I think, for months. So I had it much easier than many. And anyway, started. And then I put this as sort of a very rapid timeline of my life up until when COVID started. But since, as Meg said, we moved to Lexington late 2019, and I know a lot of you don't know me that well, or if at all. So I was born in Dorchester and I grew up there. Have been in the Boston area for a long time. This little person in the overalls is me. I'm the youngest of three. These are my brothers. That's my little cousin who's also in this picture. So I grew up, I went to college. I did some traveling. I decided late to go to medical school after sort of realizing I didn't want to be a psychologist and wanted to get more into the physical side of medicine, and did residency and fellowship. I did have a first marriage in there somewhere, but then I came on faculty after getting through all of that, and then met these guys. So that's Mike, my husband in the middle, who I think might have joined this call as well. And my stepchildren, Callie and Isaac, who this is on our old house in Somerville. I had known them for a while by then, but they were 6 and 4 when I met them. And then had Oliver, and then we moved to Lexington in late 2019, when Oliver, I think, was 3. And then this is just one of my favorite pictures of me and Oliver. This is down in St. Pete Beach in Florida, and I think a lot of people remember the last traveling they did pre-COVID. And And that is our last trip pre-COVID, when Mike and Oliver and I just went for a 3-day weekend to St. Pete Beach. And then came back home, and shortly after that, everybody started hearing about Wuhan and China and COVID, and that's kind of how things started. So when I was preparing this, and again, it's hard for me to remember the details of what happened when. And so I don't usually put a lot of words on slides, but I found the journal that I kept for the first 2 weeks. Sadly, I stopped keeping it after the first 2 weeks. I wish now that I had done it for longer, but I just included a few excerpts. So these are all verbatim, with some intervening words taken out. But so March 14th was when I sort of first started and said, I thought I'd take some notes so I can remember this experience. And, the kids' schools had just closed. We knew it'd be at least 2 weeks, but we kind of thought, I think Mike and I both thought it would be longer. At that time, there was the now very low seeming number of 2,600 known COVID cases in the US. And March 15th, I had forgotten about this, but Oliver was coughing and then had a fever. And at that time, it was basically impossible to get children tested for COVID. So March 20th, I don't remember being sick, but my test was negative apparently, and that the COVID cases were going up rapidly. I'd also forgotten about this, but I hadn't forgotten that there was a shortage of masks and face shields, but I had forgotten that, we were soliciting donations for my hospital and other hospitals, including from my dentist, who very nicely got her son to go around to her own practice and some other practices and collect some face shields and surgical masks to donate to the hospital. And then and April 1st was my last entry, unfortunately, but March 21st, the cases are continuing to shoot up. And after, I noted that people were sewing homemade masks. And even at that time, I was skeptical if those would work, but Mike and I had a lot of conversation, and I guess that after that week, we have a part-time babysitter who's normally for the afternoons, and she stayed away for the first week or two when all the kids were home, but then we decided to have her come back after she and we agreed that we felt like it would be safe enough, and for us certainly was a necessity, and thank goodness she was willing to do it. I wrote about my worry about Mike's job. He had taken his very first CEO position for a very small company of, I think, 5 or 6 employees at the time. And he started that job in February 2020. And so we were uncertain of how he was going to manage that in the sort of COVID virtual shutdown world. And that walks in the woods are best. And I know that Liz and you had talked a lot about all the walking that Liz did. And we did a lot of that too. And we made the kids do it with us. Usually with the older two, Mike started calling them forced marches because they really just wanted to stay in their rooms on their computers, but we dragged them out of the house a lot. And then March 24th, and the grandparents helped us a lot with the homeschool, like before actual virtual school started. And that we sort of made a schedule, and we did, some stuff we did, some stuff the kids did independently, at least the older two, and some stuff grandparents helped out. So Bill is my father-in-law. I think he did a talk on, I think it might've been about the Revolutionary War, although I'm not sure about that. My mother talked about the civil rights movement, and then her time in the Progressive Labor Party when she was younger, and the time she spent in jail on her 25th birthday. So it was kind of an unorthodox talk. And just other things that the kids were doing. And I just noted having this constant low to moderate worry about everything. And then April 1st was the first time I really had an ICU rotation after COVID started, and had almost all COVID patients, and the oldest of whom was 58. And Rosenberg is one of the buildings that has a lot of our medical floors. And this was when they started making this big medical floor into 4 separate, they called them pods, so 4 separate little ICUs that they created on those floors. And then just thinking about that feeling of uncertainty. So like every hospital, pretty much, we had to kind of ration our personal protective equipment. So we had N95s that we were supposed to use for 3 days before we would get rid of them. And surgical masks, it was 1 per day. And it was hard to feel like those weren't getting contaminated as you were going in and out of rooms and taking them off and putting them back on again. everybody had these like brown paper bags and little plastic clamshell boxes that they would put their N95 in when they weren't using it. And, you know, it was, now we have enough, thankfully, but it was, yeah, it was disconcerting, I think, to keep using them over and over again. And noting that my son had learned at that time to, when he would walk down the street, he would like step to the side if somebody was coming towards him. Sometimes he would even step to the side and cover his mouth if we were outside and not wearing a mask. Which kind of became a temporary reflex of his. And then at work, so I only know that our first patient was admitted with COVID on March 11th. I think that was the first ICU admission because our medical ICU director sent out an anniversary email that I found from March 11th, 2021. And she also pointed out from their note that our infectious disease recommendation was to treat them with hydroxychloroquine, which of course we don't do anymore. But at that initial time, I think in some ways it was kind of, it was inspiring to see how the critical care communities from all over the world really communicated and tried to help each other out. So, you know, it started in Wuhan, and all these doctors in Wuhan kind of put together these conference calls just to like be a bit like answer questions and give advice based on their experience for the cities for, you know, Northern Italy, and then Seattle and then New York that were kind of being hit in succession. And, you know, there were different experiences in different places, I think based partly on the age of the population being hit and everything, but it was nice to see all those groups come together. And then our hospital, like many before the wave really hit, was really kind of empty as all the other patients disappeared. And I think throughout the first surge, we all talked about that, and nobody has ever really explained it, like why people stopped coming in with heart attacks and GI bleeds and all the stuff that is normally kind of the bread and butter of the ICU, and they just vanished. And then after our first patient was admitted, first they had one little ICU that was kind of designated as the COVID unit, and then it expanded to 2. And then pretty soon, all of our ICUs were COVID patients everywhere. I'm not usually a big selfie person. My stepdaughter takes a lot of selfies, but I usually don't. But this is just, you know, me and my standard walking around garb. We used to all cover our hair with these caps. Most people don't do that anymore. One of my ICU nurse friend, Annie, then sewed all of these cloth caps for people to wear and gave me a couple of those. Eventually, as we were running out of the disposable N95s, these are just regular surgical masks, but they gave us these reusable N95s, but they had exhalation valves. So they didn't actually, you know, if I had COVID and didn't know it, they didn't protect other people from me, so that you had to wear a surgical mask over them, which seems kind of ridiculous in retrospect. But and then these are just, this is a graph we used to get every day from our medical ICU director of our ICU bed occupancy and capacity. And I know there's no need to look at all the details, but, you know, normally our hospital has 77 ICU beds. So this line here, and they created all these extra beds to max out at 140. And we never quite got to 140. I think this day was pretty close to our peak. So we had, you know, about 90 patients on ventilators, and about 125 or 130 in the ICUs. And so at this time, I think, you know, normally for the medical ICU, we have 3 attendings in-house during the day for our 3 different units. And I think at this point we had probably 7 or so here, because we had these extra surge units and we had float people to help out. And they had, on the nursing side, in the new units they created on the former medical floors, they had ICU nurses that would be paired with a med surge, like a sort of regular inpatient nurse, so that they would have one critical care certified person and one who could kind of train with that person to take care of a few ICU patients. And this is just, I don't actually know what all the numbers mean in this graph, but this was the best visual representation I could find on the internet for the kind of barrage of data that was coming out and studies, and much of it published without any attempt at peer review on all the different possible ways of treating COVID. And it was definitely a little confusing. Our protocols changed, it seemed like every week, for what was kind of our standard of what we were supposed to be doing for treatment. And then just as a kind of example of then and now, you know, on the left is the kind of standard things that we did back then, we treated people with hydroxychloroquine. A lot of people we gave azithromycin. We did not use steroids. They did use them in Wuhan at first. In Spain, at first they didn't, and then they started to. And I think even at one point, a lot of hospitals in New York were using steroids. The Boston hospitals were not. Convalescent plasma was hard to get, and there was really no evidence for it, although a lot of people thought it might help. So basically, the people that would get it would be people whose families were really strong advocates for it, which is a very inequitable way to determine medical treatments, but that's really what happened. We started off intubating people really early because we were concerned about some of the ways we support people if they need a lot of oxygen or some help, but they can't, they're not on an actual ventilator yet, is we give them something called like high flow oxygen or non-invasive ventilation. And there was a lot of concern about aerosolizing COVID with doing that. So we didn't really want to do that. So we intubated people early, and like earlier than we otherwise might have if they had climbing oxygen requirements. And then we started running out of ventilators, or being worried we were going to run out of ventilators. So we stopped doing that. And I think eventually, as everyone got vaccinated and less and kind of more comfortable with our infection control measures, we stopped intubating people early. So, we didn't use steroids. Now we do kind of use convalescent plasma. Now we don't usually, except in a couple, the practice on anticoagulation has gone back and forth several times. So rapidly evolving. And then so I just kind of wrote these things to remind me of things that I wanted to talk about. I think of COVID in surges. That's how they talk about it at the hospital. So the first surge was kind of March to May or June 2020. And the second one, I think, was sometime in the fall of 2021, or maybe even late summer. And then maybe it was both winters. So the seasons of my memories have blended with that. But I remember the feeling of like checking your mask before you would walk into a room. And this is before, now I'm vaccinated and boosted, and I don't worry. I still take precautions, but I don't worry as much, certainly. But there's a method they teach you for fit testing your mask to make sure that you don't have air leaking around it. And I just remember that moment of before you walk in the room. And I remember the days when people died, and there were a lot of those days. There was one particular day on one of the pods, and when we had 3 people die in one day, and they, none of them were terribly unexpected. They were all very late in their COVID course, because this particular unit was usually, we would sort of stabilize people in the kind of old traditional, the unit that had always been an ICU. And then when they were kind of stable enough, they would move to our ICU, to this other ICU. And so these were all kind of decisions to stop. It wasn't that, but they were still, and families really could only come in at the end of life. So it was like sort of 3 families in a row coming in to take their loved one off the ventilator. And I think, all of those things had a big effect on all the people working in those units. And then I had totally forgotten about this, but when I was thinking about this talk, we used to ring a bell when somebody was extubated, because at first, a lot of people didn't survive. And so they wanted a way to like celebrate the people that were actually getting better. So they would ring a bell whenever somebody was extubated on the surge units. And then they also would play Sweet Caroline, the Beth Israel is sort of the official Red Sox hospital. So Sweet Caroline, I think that's why they chose the song, but they would play that whenever I think it was a COVID patient who had been in the ICU. It wasn't all COVID patients, because that would have been a lot of probably Sweet Caroline playing, but they would play it over the intercom. There was one. Yeah. So I remember those. They don't do that anymore, I think, because now it went on for too long and there were too many of them. And I remember doing family meetings by Zoom, which, we still do sometimes, but is a hard way to sort of first meet a family and be telling them that their loved one is dying when you can't be there in person. And then, I remember being frustrated by seeing sort of survival numbers and who was dying, and even talking to one friend who refused to get vaccinated because the overall mortality rate was not different in the initial Pfizer trial, and trying to explain to him and others that, many people survive COVID, but their lives and their health are forever transformed by COVID. and even to the point of being dependent on a ventilator for the rest of their life. And then worrying about bringing it home, which all healthcare workers, of course, worried about. So these are, and I think that he's on here. Yeah, there he is. So my husband's on this call too, but I asked him while I was preparing this, sort of write down some thoughts. So these are some selections from what he wrote about. And so the first thing was, the biggest thing for me as a spouse of a healthcare worker, that's the parentheses are my words, is that I just assumed I would get COVID. And then it was actually freeing in some ways, because he said he didn't really worry that much about it. I worried about him getting it, but he thought he'd be fine. But that it kind of changed his thinking to never realizing he could never really have zero risk. So that obviously he would try to minimize risk how he could, but would accept some. And then, and he and I talked a lot about, a lot of my colleagues either, stayed in a hotel when they were on service and they would isolate for some days afterwards. Some people would stay at home, but wouldn't touch their children and would try to stay at least 3 feet from their children. Some people sent their children to live with their grandparents for a couple of months, especially if it was like a 2-physician household. And some of that was worry about COVID. Some of that was childcare, because I actually had I was very lucky that there's a picture of her later in this, that our nanny was willing to change her schedule and basically worked full time for us. When I was on service, she would spend 9 to 4 during the day with the kids, or especially with the youngest, with Oliver, my son, because he was only 4 at the time. So anyway, we discussed it, but we never really thought seriously about doing that, because we kind of thought the psychological damage on the kids, especially on the 4-year-old, of me being gone would be bigger. I asked my parents if they had worried about it, and my dad said, I kind of did, but then you told me your routine and I figured you knew what you were doing, so I thought it'd be fine. Let's see. And then this is there were a bunch of sort of infographics that circulated among doctor people at this time of how to come home from a COVID day and decontaminate yourself. And this is very close to what I did. We also all kept our phones in plastic bags. Nobody does that anymore, but and I actually did buy one of these UV light things and would put my phone in it when I got home to decontaminate it extra. So yeah, I'd come home, and luckily we have, a large house and multiple bathrooms, and I would walk around the house, go in the back door into the basement. There's a guest room and a bathroom down there. And that was kind of like the COVID bathroom. It took months and months for the kids to ever feel like they were allowed to use that bathroom. And we had bleach wipes there, and we had a big garbage bag that I would dump my scrubs. I actually would change before I left the hospital. I'd change again when I got home. I would take a shower. I would scrub everything a million times and drop my phone in the UV light decontaminator. And after that, I would say hello to everybody. These are more of Mike's words, my husband, that, he said Ollie had it the hardest. Ollie's our youngest. Because for a while I was working 7 days on, 7 days off. And so during the 7 days on, they had their little routine in the morning, and then our nanny, thank goodness, would come from, I think it was actually 9 to 4, not 10 to 4, but something like that. And then he would get a little screen time. They would make dinner, and then they would sort of pass the time more until they waited for me. And again, I already talked about this, but how a lot of colleagues really didn't have help with childcare during COVID. And I do remember one time when my stepson, Isaac, who was now 12, so he's probably 10, when I said something, and when I was saying goodnight to him about going to work and that I was going to be working in the COVID, and somehow I think it hadn't really hit him that I was working with COVID patients at first. And he was like, "Are you going to die?" And I said, "No, of course not. I'm going to be fine." But that was the only time really that he seemed at all worried about it. And then he mostly seemed fine. But there was a lot of news coverage about healthcare workers who had died. And I think the kids of healthcare workers certainly get exposed to that too. So these are pictures that Mike took often, I think, when I would come home from work. So I am wearing scrubs, but these are post-decontamination. So these are clean home scrubs. And these are all my clingy little Oliver when I would get home. And I think also, a big relief for him, also a big relief for me. I love my work. There are fascinating, wonderful parts about being able to take part in treating all the COVID patients, but it was definitely always a big relief to come back home. And definitely, our family, and so this is Barbara. This is our mainly for Oliver, but she helps with all the kids, our after school nanny, and who again sort of transformed her schedule and took the risk of working for a healthcare workers family during COVID. And then this is Mike and Ollie when I came home one evening. And then Isaac and Ollie and Callie and Ollie, I think, but especially because the little one needed the most help, and they all really stepped up to kind of help him when things were shut down. Although luckily his school was closed much less time than the rest of them. And this is a little bit long, but this is one more thing that Mike wrote, so that spouses of ICU doctors and nurses, that some refer to them as the second line. And that really they had to do a lot to kind of take care of everything at home while we were all at work, which is always true when I'm in the ICU, but I think it was harder and more demanding with kids being home, and obviously just all the restrictions around COVID and the added psychological stress. And he talked about one time that I don't think he had ever told me about before, about when the older kids were complaining about helping with something, and he sort of took them aside and said, it's not for no reason that I'm asking you to do this, and that they kind of stepped up after that. And just pointing out that, again, like I live in Lexington, we have a big house where it's easy to isolate one bathroom. We had a babysitter, I had lots of help, and that there were tons of essential workers and who did a lot more clinical time than me that didn't have all that help. And it's kind of, I remember talking to one ICU nurse whose husband was an HVAC guy, and those guys were really busy during the pandemic, kind of revamping all these, trying to make all these systems safer, and they just had to leave their kids who were like 8 and 12 alone a lot of the time, even when their school was shut. So community sport, this is a picture of bread in the shape of thank you that one of my neighbors made with her daughter, and that they brought back. And and I remember, like people were like dropping masks on my doorstep, and, Mike talked about a time when some of my neighbors, because I'm sure you all remember that in New York, they were doing this like pot banging, cheering thing. And our neighbors did a similar thing one night for me when I was leaving for work. And I sort of like had a nervous like fight or flight reaction when I saw it, and I drove the wrong way down the street. So I didn't drive by a lot of the people that were standing down the street, which I felt bad about later. But yeah, the neighborhood was very supportive. And I think Mike had wondered after the fact if it was really that helpful. And I think early on it was helpful for healthcare workers to feel appreciated as they went in to do these jobs. I think later, as people sort of started to burn out, it became, I think the second and third surges were hardest in some ways. These are just some things I did for recovery. So we have a garden in boxes that Mike built me in the front yard. This is my stepdaughter, Callie, I'm sure many of you were there because I think it was organized by a lot of the churches, and I know First Parish people were there. But when after George Floyd was killed, and they had people sort of lined up along Mass Ave, and this was in early June, I think, and so things were lightened up a little bit in the COVID front. But it was nice to just do something that was important, that wasn't about COVID. And then an outdoor dinner at town meeting. We had a few dinners on their porch. And then this was, I think, in September when I was actually in an ICU, but because it was in August, the kids were off school, and Mike rented a house somewhere down the proximal part of the Cape, and I would drive down there in the evening. And Callie is not actually drinking wine, they're just goofing around, but those kind of things I think helped a lot. And then the second and third surges were in some ways easier because the peaks never got as high, and we were a lot better at treating COVID by then. But they were somewhat harder too, I think partly because there was a lot of burnout, and I'm sure people have heard about, 20% of the nurses in the country are trying to get into other lines of work. I think especially ICU nurses, just a lot of turnover, and people just not wanting to do it anymore. It sounds like a petty thing, and obviously these things don't continue forever, but the first surge, I don't think I bought a meal at the hospital for like 2 months, because there would always be food sent from various restaurants. And then of course, lots of those restaurants went out of business or were struggling themselves. So things sort of went back to normal, but then with the surges, you'd be just kind of surrounded by COVID again. On the positive side, I did get vaccinated Christmas of 2020. It was great to actually over time have some proven COVID treatments that were helpful. And then all the other patients came back. So, now we struggle with capacity, but it's really because we have some COVID and we have all the other regular stuff too. And then again, over time, there were just strain, you know, our kids in general, I think, did very well, but the, you know, some of them, especially one, had trouble with the isolation, and it was just a tough year of adjusting to, you know, middle school and dealing with all the stress of being remote half the time and things like that. And then something that wasn't true the first time, but later, after vaccination was available, in most of the people that we treat in the ICU are unvaccinated, and you know, most of them have chosen not to get vaccinated. And it's actually pretty easy when you're in there taking care of a very sick patient to kind of to like not think about that. But then I think at the end of the day, sometimes when you realize like how many, not just yourself, but how many other people have been, you know, working extra hard in an extra crowded hospital and, you know, potentially putting themselves at risk. There's a lot of frustration, I think, in the medical world about people not getting vaccinated. I put the long code story there just to remind myself, but there was one patient who unfortunately passed away, but you know, in the course of that happening, he had a cardiac arrest just because of how severe his hypoxemia or low oxygen level was. And, you know, there were so many of us in that room trying to resuscitate him for an hour, and it did not work, unfortunately, but it's a very saddening, frustrating realization, just to realize how much of that could have been prevented. This is the next part of recovery. We actually went to Hawaii in June 2021. We went to Hawaii with my in-laws and my sister-in-law as well, which was sort of like a big family dream trip. And we planned it in the darkest part of the winter when it was a COVID surge and the kids were having a rough time. And this was sort of our light at the end of the tunnel. And again, very fortunate that we were able to have such a light at the end of the tunnel. And then these are just two of my best friends that I finally got to see after a couple of years. And I think that's it. So thank you all for listening, and thank you to all of these people who got me through the pandemic. And I'm happy to answer any questions about, you know, medical side of COVID, non-medical side, whatever.
Oh my God, Kate. It's just so amazing to relive that period from your perspective, and I can't thank you enough. And we already have 2 questions. So go ahead and if people can please raise their hands on the reactions button, that's easiest for people to see. And Kate can call, and then we'll kind of try to keep an eye out for others.
All right, Tom, I think you were first, so go ahead.
Okay, great. Well, thank you so much, Kate. This was so interesting. So I just, you know, I don't know if you used the word rationing healthcare. I think you might have at some point, but, you know, did you get in situations where you had to say, I've got 2 people, they both need ventilators, but I've only got 1. I mean, I don't know if that happened, but that just must have been awful.
Yes. So thankfully, we never quite got there. There were, I don't know if our hospital got them, like things like the Tufts School of Veterinary Medicine sent ventilators to some human hospitals to try to prevent that happening. And we had, some of our respiratory therapists had worked with some of the hospital engineers to figure out that if we had to, we could use 1 ventilator to ventilate 2 patients. I don't think we ever had to do that either. We pulled out like all of our old stash of ventilators. And then we used some that they usually only use like in the operating rooms for short-term ventilation. But we never quite had to do that. That being said, I think some of that hard work of sort of triaging happened on the floors before. So there were a lot of people who were people who were not doing well with COVID and who, from what we knew so far, had a very low chance of surviving if they got to the point of intubation. And the doctors on the floor, like a lot of those patients, collectively, they made the decision with the doctors to not go to the ICU. So I think a lot of them died on the floor too.
Thank you.
Rip?
Thank you so much for this wonderful presentation. There's something so powerful about actually knowing someone like you. Like I can watch on 60 Minutes or on TV, you know, but it somehow doesn't affect me as strongly as when I know someone like you and I see you. So I just want to say how grateful I am for you to share your story. I have two questions for you, if I might be so bold. One question is, I was really sad to hear you say that families couldn't visit earlier in the pandemic, and sometimes they only got to visit when they were passing away. That's so sad. Do you think that they got some support, emotional and loving support just from healthcare workers, or did you notice any of that? And then just the second question is, do you feel optimistic about the pandemic moving forward?
So for the first question, so it was awful, I think, and I hope that I don't know in retrospect if it was the right thing to do to keep families away. I think there were a lot of reasons it was done, especially pre-vaccination. Like people were just worried about people who might have COVID, especially if they were, had a family member they lived with who was in the hospital with COVID, wandering around the hospital, right? So, and also being risked, not wanting to risk family members getting sick from that person. But I think it probably went on longer than it should have. And different hospitals loosened up their visiting restrictions at different times. But, I've taught in my critical illness recovery clinic that Meg mentioned, I don't see only COVID patients, but I see a lot of COVID patients, and I've talked to family members about how horrible it was, and in their minds, like crazy, which I agree with, to be asked to make these decisions, even about end of life care, without actually being able to go in and be at the bedside of the person your loved one that you're making decisions about. So yeah, I think, and a lot of people have since written about how basically we should never do that again. And it was a really hard thing. We bent the rules, but usually we could get away with bending the rules. You could convince the higher ups to let you get somebody in, but it was hard. And usually you couldn't do that unless people were literally having to make like end of life decisions. I would say like the ICU nurses in general, like they would never let somebody die alone, basically. And I think I also probably spent more time in the room with patients who were imminently dying, just because their families couldn't be there sitting with them. So I mean, aside from having more patients die, I probably was like there physically for that moment of death more often than I normally would be, because often there's a whole family at the bedside and we're trying to kind of give them that space when that's happening. And then I remember one particular family who a few of them had come in and kind of, we had the big sit down, they were able to see their loved one, and then they left. And when we kind of stopped, it took, it's unpredictable how long it takes for someone to die. And this person had multiple family members on FaceTime on this iPad that was kind of rigged up so they could see the patient. And they were basically like having, it was like the kind of conversation people have at funerals about somebody. Like they were telling all these stories about like the amazing cocktails parties she used to throw and like all this other like family stories. And, we would sort of walk in and out and check on the patient and check on them through the iPad and stuff and hear some of these stories. But yeah, not the way it should happen though. And your other story, my optimism. So, I mean, I feel like it's a disease that we have learned to live with and learn to manage. I think with vaccination and all of those things, then yes, I am optimistic. I think it's not going to go away. It's just going to be something that we deal with. But I think we'll be able to have normal life while dealing with it. Meg, I think you were next.
I'm off. Well, that was actually going to be my question, was the psychological impact on you, your family, other healthcare workers, of knowing that this is likely to persist for a long time. So that was part of it. And my second question was your opinion on boosters for everyone, for a limited number, for limited conditions.
Like booster shots in general?
Yeah. No, boosters,
yeah, I mean,
COVID boosters at second, third, fourth booster.
Mm-hmm. Yeah, I mean, I think for the general population, I don't think, and honestly, my husband stays more up to date on the COVID data than I do. I went through a long, like I read up on the stuff I need to know to treat people in the ICU. And for a long time, like I just couldn't bring myself to follow the other stuff. I was so saturated and sick of COVID that I just didn't want to think about it outside of work. So with booster, I mean, I think whenever, and we'll have more data as time goes by, but whenever there's, studies showing that boosters are safe and seem to boost our immunity, then yes, I'm in favor of them for everybody. I think, obviously I want the whole world to be able to get vaccinated, not just the United States and other well-resourced countries, but I think that has not happened fast enough, but I think it is happening. And I think the psychological strain, I don't know. I think when it really gets to the point of it just being another, like a sort of nastier than usual flu, I think it's, as long as the rest of life can go back to normal in a sustainable way, I think psychological strain of that will be minimized. Omar, I see your hand.
Hi, sorry. My question is also about the psychological strain. I mean, I just can't imagine having this additional strain and then the duties that you had at home as a mom, which are, so enormous as well. Were you able to add any kind of self-care, like extra exercise or something, to treat that? I mean, I can still hear it in your voice, the emotional impact of this thing.
Yeah, and I did. So I put a picture up there of my garden. So I really liked. For me, one of the big benefits of moving to Lexington, aside from how much easier it made it with my stepchildren, 2 households, was the green space and being able to have a bigger garden and stuff like that. So, so that helped a lot. I ran a lot. My husband and I belonged to a gym, but obviously we weren't going there for a long time. So and out here, my running loops take me through the woods and stuff like that. So I did a lot of that. Including I used to run with one of my neighbors some as well. And then we were, when Mike and I have looked back on it, we were actually able to, like the summer of 2020, I think it was, we went to, rented a house in Lake Placid and with my in-laws and my brother and his family and my mom, and, everybody got tested ahead of time. And we just did this sort of 2 weeks. So we were kind of able to work in a lot of nice breaks, I think, that were sort of sustaining in spite of all the craziness. I don't know. Those were the main things. And then just, our medical ICU director was a huge sort of rallying point and an inspiration for all of us on the work side of things. And she would, just did all these little things, like making sure there were extra iPhone chargers and all these in like these spaces so that when people are there for long times, they could recharge phones, and having like snacks everywhere and stuff like that. Just little things, but it is true. When I think about it all, I realize there's a lot of emotion there that I often try to ignore, but David.
Hello, Kate, thank you. My question or interest is somewhat along the lines of Omar's and Meg's, and I'm wondering if the hospital as an organization did things for staff to provide emotional and psychological support for staff in a sort of a formal way, or in other words, it was established. You didn't have to just go ask for it, although you could do that too. But I'm just wondering what the hospital. You've talked a little thing about what the ICU person did, but I'm just wondering, as an institution, what did the hospital do for its staff, the staff members?
Yeah, so they did, although to be honest, I feel like probably most people, I think people sort of felt undersupported. I think the hospital did what they could. And they have the, they would sort of provide resources where you could go for, counseling, or they tried to help some with childcare. I don't think it was terribly effective because childcare resources were so stretched for everybody. And so things like that. But I know, and there's been a lot of sort of like dark humor more recently about in medical personnel about, all these hospitals trying to like hold wellness workshops and like teach people kind of like coping mechanisms and how to deal with all this stress and self-care and all these things. And when like, especially on the nursing side, like really what they needed was, maybe to be paid a little better and have more time off. So, so I don't know, but that's not to like minimize their efforts. It was kind of a crazy time. I think hospitals also took a big financial hit during COVID, which seems counterintuitive because you'd feel like, well, you got tons of sick people, you must be making money, right? But they had to cancel all of their elective surgeries, and that includes like coronary bypass surgery, like things that are, and all like colonoscopies, all these things that are kind of like a main source of income for hospitals. Critical care makes money, but it doesn't, in terms of like cost and the money that comes in, it's not nearly as good as a lot of those elective procedures. So they were stretched and worried about going under financially too.
Thank you, Kate.
Mia and Larry, I don't know who raised the hand, but the names are both there.
Hi, thank you so much for this today.
Sure.
I just wanted to say it's nice to know you and know your story. And I met Mike the other day at the service, and welcome to our community, and thank you for sharing.
Thank you.
Any other questions? Maybe while you're thinking, I will just mention that this series has prompted such a good response that we have several volunteers, maybe 6 already, to give presentations. And so we're planning a shorter series for the fall. I'm just wanting to alert you. And also for the rest of this year, this church year, we're planning a 4-week course on the Bhagavad Gita, which will be taught by Raj Peda, who many of you know because we've been in partnership with him. He is incredibly enthusiastic about the Gita and about teaching this. It will be on 4 Tuesday nights. You'll get publicity, but just giving you advance warning. Starting April, oh gosh, somebody's gonna have to help me. The last Tuesday in April, going going for 2, missing the 12th of May because of the board meeting, and then finishing up in the next 2 weeks. So you can kind of plan for that. And now that has given a chance to Tom to ask a question.
I have struggled to try to understand why people are not getting vaccinated. And I'm wondering, when an unvaccinated person comes into your ICU, I mean, do they express regret? Do they say, well, I would have gotten it anyways? What's the typical response?
So first, there are many people who, by the time I meet them, they're already intubated, so they can't really talk to me about it. But and it's also, so I don't usually ask people that like when they're acutely sick. So
I agree.
I did, but I've talked to families about it. And a lot of time, there was one guy who, again, unfortunately passed away, but he was the one of his 4 brothers who had not gotten vaccinated. And they all said, oh, we were like calling him every week and saying, you got to go. And he kept saying he was going to get around to it. And they just thought he was really scared of needles. A lot of people say they were worried about side effects from the vaccine. There was one patient I had who, I didn't get to talk to her about it, but her son just thought that COVID was a hoax, even when she was dying of COVID. It was horrible. But another patient who I saw in my recovery clinic, who, he is now getting vaccinated, but he still kind of skeptical if it's the right thing to do. He's doing it because his daughter is like insisting that he do it. And he doesn't want his family to worry. And, but he, and he asked me, he's like, Doc, do you really think would I really have gotten less sick, you think, if I'd gotten vaccinated? It's like, yes. But he still was skeptical and he couldn't really articulate why. And I don't know. I mean, I think there's so sort of science and politics have gotten so confused for a lot of people. And it's, like even my stepdaughter, when my husband was, has been advocating for, schools reopening and at this point in schools with their vaccination rates and all that stuff, like making masks optional and things like that. And, she was calling him a Trumpy. I'm like, your dad is not a Trumpy. He's following the science and the science has evolved. And, but in her mind, it's like your political leanings are linked with whether or not you wear a mask and get a vaccine. So, and I think in a lot of people's minds, that's sadly true because of where people get their news and everything.
Thank you.
Ruth. Unmute.
Yep. Hi, I'm just doing little things. Okay. There have been stories from time to time, especially during the surges, about people, either the patients themselves being violent in their denial or their families being accusatory, even violent against healthcare workers because of their strongly held beliefs about vaccination, about anti-vaccination, feeling that it's a hoax, et cetera, et cetera. In your experience, I know that things may get sort of overblown in the media, but did you encounter much of that?
I didn't really, no. I mean, I think certainly encountered some sort of like general distrust, and especially when patients were getting worse or some unexpected thing would happen. Although I think that's kind of completely natural, again, when people are not able to be there in person, because you just have to trust what this voice on the phone is telling you. And I think that is understandably pretty difficult to do.
Yeah.
So I did not.
Good, thank you.
I am moved to ask one last question. Unfortunately, my sister, who is hardly a Trumpian, is an anti-vaxxer in this case. It's very painful, and she's very susceptible. I mean, she would not do well. But I just wonder if it does no good to have a rational conversation because she goes to totally different sources for information. Do you have any advice based on what you've seen of what might work?
I don't know. I mean, I think, again, the people I've seen who've gotten vaccinated in spite of not really thinking that it makes sense scientifically have mostly done it for their family. So I think, yeah, almost like asking for it as a personal favor, which maybe you've already tried.
Maybe what?
Maybe you've already tried, but
yes.
Yeah. So, but unfortunately, yeah, it's really hard.
Yeah. Thank you again. It's really for me has been not only interesting to remember and to learn what it was like from your perspective, but it was an emotional journey as well. And thank you so much.
Thank you for having me.
Thank you, Kate.
Right. Thank you, everybody. Bye-bye. I'll see some of you tomorrow night.
Yeah.